Well, new research shows suicide risk has spiked since pre-pandemic years. The numbers are especially jarring when it comes to teenagers.
Yeah, in this week's Wellness Check, we're taking a closer look at the impact suicide has on Nebraska teens. I spoke to a local psychologist who told us how parents can process this crisis. Teens are taking steps toward better socialization these days, but that doesn't take away from 2 years stuck in isolation brought on by the pandemic. Last year, the American Academy of Pediatrics declared a state of emergency for children's mental health.
I think it's been a crisis. I think the pandemic has heightened the crisis. Overall, I think our rates have increased as a result of the pandemic.
We decided to take a look at those numbers in the state to see how kids are being impacted and just how severe the crisis really is in Nebraska. Dr. Michelle Rowley-Roberts, a licensed clinical psychologist, says oftentimes suicidal emotions stem from feelings of isolation.
Because of the isolation that was happening for families, we saw increased rates of emotional abuse, physical abuse, particularly for our teens who identify as LGBTQ. And so that's certainly contributing nationally to the higher rates.
Although research is still being conducted to understand the national spike in suicide rates, experts often point to social media as a trigger.
Research would say that if you spend 3 or more hours a day using social media, you're at higher risk for a mental health disorder.
Because social media perpetuates feelings of loneliness in teens, Dr. Rowley-Roberts suggests limiting a child's time on all social platforms.
My recommendation would be to limit your access to social media. As hard as that feels like it's going to be, taking some breaks from social media would help you in the long run.
So when should you, as a parent, start to worry about your child's mental health?
Isolating more, spending more time on media, or just not doing things that your child would typically enjoy doing. That's definitely a warning sign. Taking a lot of risks, like doing things that seem really dangerous, like all of a sudden your child is drinking a lot of alcohol or running away from home. Those kinds of things would definitely be risk factors.
If there's any silver lining, Dr. Rowley-Roberts says research shows that suicide rates haven't really changed in Nebraska specifically. She says that could be the result of the swift rollout of telehealth services.
In Nebraska, we saw the rates not necessarily change as a result of the pandemic, and so one of my thoughts on why the rates stayed about the same is that our services got prepared really quickly to do telehealth. So outpatient and partial hospitalization quickly, within a matter of a month of the pandemic happening.
And if you or someone you know is in crisis, you can call the National Prevention Hotline at 1-800-273-TALK. You can also call the Nebraska Family Helpline at 888-866-8660. And we'll have more resources on our website, 3newsnow.com.